Welcome back to the conversation. I'm Benjamin Dixon, host of the Benjamin Dixon Show. Joining us now is Laura Packard. She is founder of Healthcare Voices, healthcarevoices.org. Laura, thank you so much for joining us today.
Thank you for inviting me.
The pleasure is ours. The conversation is about healthcare, the Affordable Care Act, and the importance the role that it plays for so many Americans. Tell us about what's going on with it and why we need to bring some attention to that matter right now.
Well, there's a case before the Supreme Court right now that could strike down part or the entire law. And this case has been working its way through the courts over the past few years. And now it's finally here. A decision is imminent. And I'm a stage 4 cancer survivor, and the Affordable Care Act saved my life. So I am one of the millions of Americans that could be affected.
Oh, absolutely. There have been absolutely relentless attacks on Obamacare, the Affordable Care Act, since it was signed into law. And it seems like every so many years there's a challenge to it. We had the previous Supreme Court challenge to it when Justice John Roberts surprised a few people. Tell us about this particular challenge and the balance of power on the court and some of the possible outcomes.
Well, this particular court case came about because the Republicans tried and failed to repeal the Affordable Care Act in 2017. But what they did instead was they struck down the individual mandate as a part of the Trump tax scam at the end of 2017. So when they did that, they set into place this possible court case. The people are arguing that the Affordable Care Act should be stricken down entirely, that once the mandate was removed, the entire law should go away. So that is the conservative legal argument. Scholars don't seem to think that has any weight, but the Supreme Court is its own thing. So they can do whatever they want, and we have no control over that.
Yeah, they have a level of commitment to repealing the Affordable Care Act, which has always been sort of strange to me, considering that it is a conservative piece of legislation, the brainchild of the Heritage Foundation in many ways, first put into practice by Mitt Romney in Massachusetts, Romney Care. So this is a conservative piece of legislation, but they have not. I mean, it's been in law since 2010, and they're still fighting against it when it's one of their own ideas. Why? What is the purpose for them to try to hurt so many people in their commitment to this?
Well, I think partly it's because it was passed into law it was led by President Obama, and there are many conservative legislators that just can't stand anything that Obama did for the obvious reasons. And also part of how the Affordable Care Act is funded is by tax on the rich and corporations. So if they manage to destroy it, they give a great big fat tax break to their fat cat donors.
And they're committed to that above anything else, right? You mentioned the connections and the interconnectivity of the different players here. I'm curious as to how the new bench, the new court, the new balance with Amy Coney Barrett. I'm interested in seeing not predictions, because you said the Supreme Court, it is its own thing. But I am curious, what are some of the possible outcomes that you are calculating for right now?
Well, this is why so many of us tried to stop Brett Kavanaugh from getting on the Supreme Court, and Amy Coney Barrett in turn, because we knew that they were being put into place to destroy this law and many others, such as your right to reproductive care. Yeah. But we don't know what they're going to do. It seems from the argument phase that they are looking skeptically on the conservative position on this. But again, as we saw with Bush v. Gore, if the Supreme Court wants to do something, they will just make up the legal argument to go with it.
Along with a little phrase that says, never do this again, though, right? With Gore versus Bush. And so you're right, they're their own entity, and they have taken the prerogative to set the course of this country on their own merits before. So we can't be surprised if this goes south. If it does, we're talking about tens of millions of Americans losing their health care. Speak about that.
Well, 31 million Americans get their health care right now through the Affordable Care Act. Those numbers just came out a couple days ago. But it isn't just those 31 million. It's 135 million Americans have pre-existing conditions. And so whether you have your care through the Affordable Care Act or not, you might have to worry about annual and lifetime limits coming back on your employer's insurance. Or if your employer ever lets you go and you have to use the ACA for your insurance, then what do you do? As well as all the essential health benefits that were rolled into the ACA that people now take for granted, getting free primary care, your kids being able to stay on your insurance until they turn 26, all of those things could be gone if they strike down the entire law.
What do we do? Because there's not a lot of pressure that we can place on the courts by design. But if someone's feeling hopeless and helpless in response to this, and not only this, because this seems to just be a prelude to what is going to potentially happen around Roe versus Wade, what are the people to do?
Well, the courts matter. So going forward, make sure that you vote for people that will work for healthcare instead of trying to take it away. If this happens, if they strike down part or all of the Affordable Care Act, then Congress needs to act. And it's going to be tough. I mean, we need to have gotten rid of the filibuster yesterday. But there may be things that Congress can do in an emergency to shore it back up. And we have to do those things because we can't strip away healthcare from tens of millions of Americans.
And let's talk about the politics of it, right? I mean, because there's a moral dilemma here, and you would think that we would understand why it's important for sick and dying people to be able to have health care, but that's a whole different conversation. Politically, putting 31 million people off of their insurance, even if it's 2 years before the next election, is completely political malpractice. But they're so committed to this that they're willing to take it on the chin. Do you think that's because they are confident in their conviction on working on behalf of the rich, or are they confident in their conviction that their supporters are dumb? I'm sorry, but that's kind of, I hate to pose it like that, but it came out.
Well, I think a lot of people don't get a full picture of the news. If you only listen to media in a right-wing talk show bubble or Fox News or OANN or Newsmax, you're not getting the full story. And so all of these politicians vote to take away your health care, and then they get on TV and say they're protecting your health care. So if nobody fact checks their record, the average voter, how are they to know?
And this is how they're able to get away with doing so many things that are going to be detrimental. When should we expect a decision on this case? When should we expect some results?
Well, the Supreme Court is almost done, and decision days in June have been on Mondays and Thursdays. So at this point, by the time you see this, there may have been a verdict, or it may be next week, Monday or Thursday.
And if it is a case that they overturn it, what kind of time frame would people who are on Obamacare, how long before it actually cuts their services, or would it be almost immediately?
Well, that's the question we're all worried about, because is the Supreme Court going to stay their decision, or is it going to take immediate effect? And a lot of these insurers have it written into their contracts that they can cancel it if they need to. So we could live in a world where immediately after the Supreme Court strikes down the ACA, people start getting notices from their insurance companies that their policy is canceled.
And in so many ways, like this, I know there are some negotiating techniques in here that healthcare industries did not like, or pharmaceutical industries may not have liked. But in a lot of ways, this was Obamacare gave a lot of money to insurance companies. Where are they in this fight? Or are they just more than happy to take wherever the windfall comes from?
Well, the Affordable Care Act, the Obamacare fight in the first place, it was a deliberate policy choice by the Obama team that they were only going to fight so many industries at once. So there were giveaways to big pharma. For example, there's no negotiation of prescription drug prices in Medicare and so on, because Obama was taking on the insurance industry. He didn't want to also fight with big pharma and the providers and everything else. So like, it's some ugly looking sausage sometimes, but it was made up from choices, what they needed to do, they thought, to get it passed. So the insurance companies actually have benefited quite a lot. More and more insurance companies are going on the Obamacare markets because they can make a profit there. So they're going to be unhappy about this, but at the end of the day, insurance will always figure out how to make a buck on your healthcare.
At the end of the day, insurance will always find a way to make a buck on your healthcare. Laura Packard, founder of Healthcare Voices, thank you so much for your time today.
Thank you.
Pleasure's mine.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat, emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.